there are a lot of complex reasons why this crisis has hit Indian country harder than other places, but those reasons translate to all of the other health disparities and health challenges that tribes face as well. I think that you're looking at very vulnerable populations of people who have a relationship with the federal government through the treaties, the trust responsibility, and have very vulnerable healthcare systems that are funded below 50% of need, despite those funds being promised through treaties, law, and the political status of our people through the U.S. Constitution. So you are dealing with rural and remote America in many cases. However, I think one of the foundational issues that's really important to understand is that because of our status as sovereign nations and our relationship with the federal government, when funding is brought from Congress through state block grants to fight the opioid crisis, the states are under no obligation to share any of that funding with tribes because the relationship is with the federal government. So I think you have a number of circumstances conspiring. One is structural. One is unmet promises to Native people that have existed before the existence of this country. One is communities that live with the trauma, post-colonial trauma that they have experienced in their own ways, their own unique ways. I think the number one disease that our people suffer from is anonymity or invisibility. People don't think about Indians. They don't have knowledge of the treaties that exist in the social contract between the U.S. government and the many Indian nations. But some of the tribes are able to use their own resources to create clinics, to partner with local and state governments when possible. Washington State, tribes in Washington State, led by the Swinomish tribe, are doing an excellent job of creating clinical opportunities for people to receive drug treatment, drug counseling, and preventative measures. So in Arizona, throughout the country, you're seeing tribes have an insurgence of returning to cultural ways of knowing and cultural ways of treating addiction, and a revitalization of those cultures as part of the answer that is successful for our people.